I'm going to do my presentation in French, but first of all, I would like to make a comment for my colleague Boden Jones.
Equally as serious to deal drugs and to like reggae. So I do disagree on that point with him. Alors, donc je reviens en français. Donc, je suis formé en
Switch to French. I was trained in France and I work in London. When I was invited to address you here, I was happy enough to speak French. I'm children psychiatrist, and I have 2 decades experience in ambulatory care and in an hospital setting at a different level, security level. And as was said previously, I worked with the psychiatry unit for children at the European level, and during my thesis, I worked on a comparison in that field between the different countries. Obviously, it's very different from one country to another. But it helped me think about my own practice, about the different mechanisms. I studied a lot of ethics, a lot of philosophy, and I'm very sensitive. I like to think about the right clinical decision for each patient, and sometimes I question what has been done before. So I drove it myself. I'm going to talk about hospital and about a teenager that is being treated in a hospital setting. What I would like to do is to provoke thought about the different care systems. I would like to raise questions about the decision process when you are going to treat a teenager in a hospital setting. It is generally a medical decision, and if everything goes rightly, every involved stakeholder in the treatment of the teenager is consulted. I thought, and I think that the way in which care is being given is binary. So we have ambulatory care, and very quickly sometimes, or suddenly, the teenager is accepted in hospital. And sometimes I thought it was not very satisfying, and I thought there was a lack of an intermediary stage, if you like, and I would like to talk about that right now. I don't know what happens here in Brussels. I don't know how the different units are organized for teenagers, but I suspect that it is a bit like what happens in other cities. Generally, we accept that teenage pathology goes with more crises than other people, than other age groups, because teenagers act out, because they like to defy. They have a lot of emotional factors, and of course the emotional regulation and impulsivity are processes that are quite unstable for teenagers. Some youngsters can have risk behaviors because they grow and they have the grown-up size, and they have no intellectual capacities that enable them to reach their goals and to carry out their destructive pulsions. And it is, of course, difficult to deal with. I'm sure that many of you who worked in the clinical field know about what I'm talking. These emotional and behavioral characteristics need to be taken into account in the way in which a teenager is managed. More often than not, they are treated after a crisis. Very often they refuse previous support, and when they are admitted to hospital, this is the first time when they get care, because they are not mature enough. And as was said previously, I in fact remember very well what was said about the parents' positions in the care. Clinicians need to treat teenagers, and parents are generally those who take decisions. And I was very happy about the exchange about the way in which you could manage parents. Sometimes some parents are inflexible. They don't want to accept what is being said to them. And I agree with what Dr. Bodden said. A parent, a narcissistic parent, it is better to agree with him. And it is better to have challenges elsewhere. Because generally, in the private sector, the parents are the ones who decide whether or not the child is referred or not, is treated or not. So the parent's place is very important indeed. It's very right. And all of you are very experienced clinicians, I'm sure, and so you're very well familiar with that. But I wanted to talk about that to lay the stage, if you like. So I would like to talk about the limits of hospitalization. Why hospitalization is not always helpful, and then I would like to talk about the interest of admission to hospital. Taking into account the previous comments about risks, I think that hospitalization can give a false feeling of reassurance, because it gives an immediate solution to control the behavior of the teenager. Of course, it can be true sometimes, but it has potential consequences, and they need to be taken into account. These are emotional repercussions, and sometimes they have an influence on the positive or negative and development of the patient. I have had many young patients hospitalized in France, for example, and they didn't want to be hospitalized, and very often under HDT, in violent situations, they have been forced to go to hospital, and they had a trauma about that. And it is interfering with their confidence. They don't feel the same trust with the clinician. It's a shame, in fact, to handle a situation in such a way. Of course, sometimes you don't have a choice, but maybe it's good to reflect about that. You might ask those questions to your patients. What are their experiences of the past hospitalizations? And maybe you might find yourself in a situation where you hear that it's not really positive. Sometimes parents ask for hospitalization of their child, of their teenager, and I explain to them that it's different than to a normal hospitalization. We think that for medicine, for general practice, it is better to hospitalize because it is you get more intensive care. But it's not the same for psychiatry. Of course, you have different resources in a hospital setting, but some elements are sometimes more important to the access to therapies in a hospital setting. So the setting in itself is important. The situation of the patient, the experience of the patient, the feelings of the patient, I will talk about them later. As I was saying, when I ask questions to my teenager patients about their hospital experience, sometimes they depict their stays at the hospital in a negative way. They say they feel anger towards that. They feel they were deprived from the freedom. They felt in a cage. And in fact, they thought that another imposed its own control on their lives. And sometimes it reminds them of very negative experiences, humiliating experiences. And I suspect that you had the same comments from your teenage patients. I'm sure of that. Hospitalization can also destabilize relationships with friends, with relatives, with school also. You all know that it is life for a teenager is complicated, and when you get admitted to hospital, you get a message from the school saying that they don't want to have him back. And sometimes in some families, when they see that life is easier without their teenager, it's difficult for them to have him back in the household. So some of them are sometimes wondering whether it would not be better to have their child stay longer in hospital. Of course, then if you are separated from your family in such a way, it can trigger feelings that are of abandonment. So these are all negative points about hospitals, but there are positive points, and I'll talk about them. And I talk to many teenagers, let me reassure you. So the setting now. All who work in that sector, in that field, know it. The setting is very peculiar indeed. It's sometimes even shocking. Being hospitalized with other people that suffer from sometimes more serious pathologies. A person that has never been exposed to psychotic disorders can be shocked because it is frightening indeed. But that exists, it's reality. So let's have a thought about that teenager that suffers from the psychotic disorder. And sometimes being hospitalized has a terrible impact for the teenager, because the teenager feels he's crazy sometimes. So it's not the best way. It's very sensitive indeed. When you regroup angry teenagers in a closed setting, it might be complicated. It is complicated generally, in fact. And as in a prison, sorry for that comparison, but I need to do it. Some teenagers who maybe don't want to feel better, some of them have an influence on other young people to do self-mutilation, to steal, to hide tools that might be used for self-mutilation. And it's terrible, but it happens in hospital settings. The different accounts from teenagers I get, well, they say that in the hospital, they were not responsible at all. They were having risk behaviors, and they say that it was not very constructive. They also say that they don't want to create contact with the others, the other youngsters that are also hospitalized at the same time. Maybe it was not the right place for them to progress. Now, what are the advantages? What are the benefits of hospitalization? Of course, we could say the contrary of what I've just said. Separation from the family might be crucial when the crisis comes to a head. And people living in couple know that sometimes when you're too close, when you're living too much with each other, it's not especially good for a relationship. And that also applies to teenagers, because sometimes there is so much anger towards parents that they can't live with each other. They don't feel love, they don't feel recognition, and when they are separated, they don't feel that anger towards their parents. They are at war with the nurses, for example, with the doctors, and they feel that they miss their parents. It's not all black, it's not all white. We need to compromise. Of course, the hospital is not the only place where you could find that solution, but this is one example where hospitalization might be useful. Of course, it creates a direct limit to the behavior. When you have a very high risk, sometimes you don't have other alternatives. Many children are still living today because they were hospitalized, of course. A hospital is a psychic space where the teenager needs to think. It's a new environment. Maybe the teenager didn't wish for that environment, but it's a different one, and it might help him to think about his life, about their friendly relationship, about their friends, and about what we talked earlier on with Dr. Burden-Jones, with substance abuse. It's not just an individual problem, substance abuse. It is a psychiatric pathology that has a lot of social aspect to it. Dr. Burden-Jones is more of an expert into that field than I am, but of course, a teenager taking drug, the best thing that he can do is change friends. If all of his friends share the same passion for drugs. Then a teenager can reflect on her choices that led to the hospitalization. And teenagers now, and might be the same for grown-ups, by the way. Once you have that limit, even though it was done through violence, through conflict, through emotional distress, it sometimes leads to a depression, to a depressive reaction. Sometimes the behavior of the teenager translates a kind of depression. Generally, a depressed teenager won't cry for help. Generally, is angry, is unhappy, it's the fault of another person and generally the parents. So it is a depressive reaction. It is an important stage to lead to change, in fact. As was said previously, also, hospitalization for teenagers, refusing any sort of help, is sometimes the first stage to treatment. So sometimes you have no choice but to hospitalize them. I thought about the role of hospitalization, and by the way, we always talk about that with the public authorities that have to pay for hospitalization. In the UK, these are funding committees, the funding committees of the NHS, and it's very difficult to manage. The main mission of hospitalization is to avoid any further deterioration of a situation. We not always expect an improvement in the situation of the patient. It's rather to control the situation. And it is recognized by psychiatrists. Of course, there are therapeutic tools in the hospital. Normally, we should have more. Sometimes in some services, in some bodies, we don't have enough funding. And therefore, they don't have all the therapeutic tools at their disposal. Of course, teenagers are in a closed space, but they don't get the right therapy. Once again, hearing the feedback from my patients, I realized that they didn't progress so much at hospital. The psychological progress is rather made in the context of a therapeutical relationship with a doctor, a relationship based on trust, on empathy. A few years ago, a study was carried out, I don't remember its name, and it concluded that therapy success was not as much associated to technique, but rather to the quality of the relationship. It might be stating the obvious, but I think it's also good to have evidence of it, and to keep that in mind. Teenagers going to hospitals are deprived of any relationship. And the relationship, the only relationship, are the friends taking drugs. So when you have trust, you can see that it is very helpful for the treatment. Sometimes a hospital can be very busy. There are a lot of people. You have the night shift workers. Sometimes you have 3 shifts on the same day. Sometimes you have a lot of change, of rollover of staff, and therefore you might feel surrounded by foreigners, by people you don't know, by strangers rather. And you need to recognize that it is quite difficult a situation for these teenagers. The aim, of course, of a hospitalization is to get out of the hospital. That's the aim of the patient, of the parents, of the doctors, and therefore it imposes limits in time and also in the relationships with the staff, the hospital staff, and those limits need to be taken into account. I'm not going to give you a simplistic conclusion, a ready-made conclusion. Rather, I would like to offer my insights, and maybe you would like to add something. I invite you to reflect over the advantages of hospitalization and also the disadvantages of hospitalization. For me, hospitalization is rather a conventional, traditional way of treatment. And I would like to talk with you about what kind of other units can be created. Some of them already exist. I developed one of them, and I will talk about that. So what can we create? What can be designed in an organizational way to help teenagers? Because teenagers have peculiar characteristics because of their age, because of their pathology also. So when I was working in a hospital setting for a variety of pathologies, psychotic pathologies, depressive behaviors, risk behaviors with no real underlying pathology, because you have a lot of them in a hospital setting, I always thought that it was a shame that these youngsters were hospitalized. When I think about the support they got before getting in the hospital setting, and it made me think, if we had enough ambulatory care, intensive care for that patient, maybe we could avoid hospitalization. I'm convinced about that. For some patients, maybe not for a psychotic patient, but maybe even for him, because if he can take the med earlier on, it could help. Could it avoid hospitalization? I'm convinced that it could avoid it, and I would welcome your comments about that later on in the Q&A. But what is an efficient ambulatory care? I would say that it would require commitment from the patient. It would require relationship, empathy, everything that has been described earlier on. If you have social services, in the UK it's a disaster, but in France they have a bit more resources. If you have social services, it can be of great help. When you are a clinician, sometimes you are limited in your scope. School needs to be involved as well. School needs to be understanding. Of course, you don't have a control about that, but I think that all of those criteria lead to good quality ambulatory care. And of course, if you have ideas, please feel free to express them. I work exclusively in the private sector. I no longer work in the public sector for 5 years now. And in France and in London, I worked in the public sector, and I developed an ambulatory service in the private sector. With that idea in mind, I wanted to create a mechanism that is flexible with resources, not waiting for the teenager to come to the consultation. If the teenager doesn't come to the consultation, we have the resources to go and meet him at home, and all of that is created within a service of intensive outreach. I created the project Young Persons Treatment, based in London. It's multidisciplinary care based around the dialectical behavioral therapy. Many of you may have heard about that already. It's a bit like CBT. It's based on support given to teenagers to control in a better way the intensity of their emotions. with very accurate strategies. It's in fact a skills-based therapy. And sometimes it is different to the transference-based therapy or psychodynamic therapy. It's different, or other traditional therapies, and they are very useful. I'm not criticizing that. They are very useful. They are talking more. They are focusing more on the life of the teenagers, the relationships, thinking about the emotions towards other people, everything that deals with transfer and counter transfers. And the service on the behavioral counter therapy, we have a counselor helping parents, supporting parents, so they see the parents alone, and we also have a photographer doing a mentoring job, a creative job with the teenager. It's not, the aim is not to think about their life, rather it is to have a creative activity. Of course, the photographer can work on other activities as well. That service has been put into place 3 years ago. The results were very good indeed. We have had many patients, and we have been able to avoid hospitalization of many of those patients. We could do that because we had coordination resources, because we had enough flexibility, and at the end of the day, it's very important that the funding bodies understand that it costs less than hospitalization. These are all general comments, of course. Every teenager is different. A psychotic disorder is different than another disorder, and of course, those aspects are being taken into account. After 6 months treatment, the patients that have done the dialectical behavioral therapy, so after 6 months, the majority of them are back in an active way in their education. They have better family relationship. They have better interactions with their peers, and of course lower risk behaviors, or even disappearance. No more risk behaviors. So these are good results, and I wanted to share them with you. Of course, I'm aware that it is not the only service. Of course, there have been other attempts, other successes in other countries, but it was rather more thought-provoking, if you like, to think about innovating services that are not respecting the binary organization of hospitalization or ambulatory care. So very quickly, and I'll then conclude, so that we could exchange together. No, when a patient that couldn't be helped anymore, couldn't be supported anymore in an ambulatory setting, and that is supported by other services, I used programs coming from the US, wilderness programs. Maybe you've heard about that here in Belgium. It was a source of inspiration for me because they are very innovating programs. The origin of those programs are boot camps, difficult children sent to those quasi-military camps, maybe substituting the military service. We have now a lot of therapy, less discipline, and there is less focus on that military atmosphere, and the results are quite amazing. Let me describe how it works. Very often teenagers don't want to go there, of course, we all know that, and you need to be very clever to have them there. Those who are taking drugs are not against going in such a camp when they are searched by the drug dealers because they owe them money, and so they are in a different setting, if you like. And it is thought-provoking. It is a change of psychic space. They live in wilderness, in forest, if you like. In the US, you have different programs in the Utah, near the Grand Canyon, or in the Nevada. And with a group of other teenagers, they will have a nomadic kind of life with that wilderness group. No technology, it is an important aspect. No watch. So the importance of the sun is key, to know what time it is, to know when to go to sleep, to know when to eat as well. Generally, those programs last for 2 months, and after them, children completely change their processes. Sometimes before that, because of anxiety, they were controlling everything. No, after that, they accept that they can't control everything. I didn't work within those programs, so I just give a few general comments about them, but I'm not an expert of them. So nature imposes limits, and when you live in a modern civilization, in a city with technology, where you have access to everything constantly, you haven't those limits anymore. And because of those programs, they change their way of thinking. It's very astounding, surprising. They discover the impact of their behavior on other people because they need to live in a group. They have to help each other, to listen to one another. And of course, in a fostering environment. Sometimes they see bears, they are faced with tarantulas, and all of these stories come from teenagers that accomplished those programs and that were really happy to take part to those programs. So it's an example of innovation. The authors of those programs decided not to be in a hospital setting. I know that my colleague of Yes We Can, Piet, is going to talk about that innovating setting. He will talk about that. And I sent patients to him, of course. The goal of my speech today was really to provoke thinking, to wonder whether there are better settings to take into account the aggressiveness, the emotions of the teenagers, the need for strong feelings. I wanted to talk about that. Do we have any mechanisms, as those I described, that can be funded by governments, by insurance companies? Do we need to have a debate about that to promote those new forms of care? Thank you very much.
That was very interesting and nice to see the other side of the picture too. I like your idea of how you ended by saying we need to look at new programs. And it's very true because a lot of adolescents do find the programs in the States with the hiking very interesting, and it would be really nice if we could have something like that in Europe.
Well, I have a question if there are no more questions in the room. I don't want to... Is there anyone with a question first? Because I have...
Jump anyone. Thank you.
Yes, well, I get the feeling more and more that teenagers and this period of one's life is about emotions and behavior. It's about exploring these behaviors, defining limits, barriers, what is acceptable, what is not acceptable, pleasant, unpleasant, through this behavioral learning. That's my reflection as a practitioner. Of course, I'm not a specialist myself, but does it imply, I'm thinking about this DBT, does it imply that maybe we should start with behavior before anything else? When you work with teenagers, it's about changing their behavior, about exploring the behavioral limits, reaching the bottom in order to really see what is the limit before one burdens themselves. Should it be really the focus when working with teenagers? Well, thank you for your question and thank you for your comment. Well, maybe we should talk more about how can we manage teenagers, and there are many overlapping points with the previous presentation, I think. When I was listening to the questions before to Dr. Bowden-Jones, well, should we deal with the cause and not only with the symptoms? And he gave a very good answer. I fully agree with him when he said that it's a good thing when there is a team, when a professional deals with the practical aspects, and then the other part should maybe deal with the cause and the emotional dynamics that have an influence. It can be a psychotherapist or other. But when dealing with a teenager, I think it's very useful to think and bear in mind that this individual, from a psychological, makes a very fast progress from a psychological point of view. And so it's very useful to, let a teenager do his bullshit, between brackets. I mean, of course, if it's not too risky, and so that he will discover by himself the limits of acting such a way instead of, working and talking during weeks, having an argument between him and his parent about who's wrong and who's right. And I fully agree. I think this is related to your point, Christopher, on behavior. I think it's good to talk about behaviors with the teenager and maybe let the aspects related to the causes come a bit later, and it should come from his own initiative, actually. All those programs indeed enable this kind of processes. But I would like also to make a comment. Very often, there are, some creative projects have been set up, especially in the UK, with boarding schools. The boarding school culture in the UK is very specific, very unique, because many children attend boarding schools. I'm not saying that in a bad way. I just, observe. That's a fact. That's a fact. In France, usually children going to boarding schools, are children who have acted in a very bad way, very naughty children, and usually it's very negative. That's not the case in the UK. In the UK, actually, good schools are boarding schools, most of them. So it's very interesting. There are many complicated dynamics related to boarding schools, amongst them the way it affects the relationship between children and their parents. But nevertheless, one has to acknowledge that this separation that is necessary between a teenager and his parents, actually you reach the results when you send your child to a boarding school. And we see that when they come back during summer, it's quite complicated and everybody is waiting for the month of September. So I think it's another example of creative approach. Well, it was not set up in such with such a purpose, but these programs and these schools enable actually and make it possible to reach such results. Thank you, Paul.
Your comment about boarding schools. Being Irish, we do boarding schools from a different point of view to the British. And I know some have been very happy and some that have not, and I think that's a whole other subject. But it does seem to me that adolescents have problems expressing their emotions, dealing with their emotions. And maybe we need to go back to educational systems to provide some support for them. And I'm wondering, do we not need more support for parents? Because if we go back to our first speaker this morning that talks about that some of these addictions come because of problems, either related to home or early experiences, is that not where we should be concentrating as well as dealing with the problems of addiction at a later stage?
Can I answer this one in English? Yeah. So, I mean, I am not. Yeah, I entirely agree. I mean, I deliberately didn't focus the presentation on addiction in itself. I mean, I'm actually thinking more in terms of more general behavioral challenges. But yes, I mean, I agree. I think any intervention that allows the family, the system, the kid, obviously, the younger they get, the more difficult it is to reflect emotionally, that allows them to reflect on what's going on and not just react, will obviously be very beneficial. Resources in school, sure. The dynamics within the school are sometimes difficult. Many kids don't want to get help within the school because it becomes obvious to the peers and but I agree. I think everyone has a role. I would comment. I mean, in my general approach to teenagers, I always see them with their parents, as much as possible, as the sort of default approach. Obviously, when things are difficult, we have to separate, or when the young person needs to share things with me that he doesn't want his parents to know, we will separate and have a sort of a time together. But actually, commenting on what was said earlier, I generally like to see everyone together so that they can actually hear their differences. Start on. They can hear their differences and rather than argue, just reflect that we're all different and we're allowed to see things differently. And usually, I would say in 80% of cases, 25% of cases, that works quite well. But absolutely, I agree, and I didn't in any way want to contradict with that. Yeah.
Instead of our educational systems focusing on academic development of our students, do we not need to go back and start looking at how we operate as human beings and giving our children the education and the tools to be able to become individuals that can deal with difficult things, basically to be given more tools to deal with those situations? And also, do we need to start looking at parenting and how we, as a mental health clinician organization, help parents deal with the problems before they become problems, or deal with parenting before it becomes a problem?
I mean, I would just comment on the example of mindfulness. So mindfulness obviously was established and proven to be very helpful, and certainly the educational community took that on board big time, and it was all over the place and so forth. And I think some kids came back saying, this is just so weird, laughing it off, in a slightly classroom defiant attitude way, Others, maybe because the person delivering it did a good job, I don't know, maybe they had a different classroom or they did it in smaller groups, the educational setting, sometimes gives rise to those classroom defiant positions. But I hear you. I mean, all of these young people, every single one, if something could have been done earlier, it would have been helpful. But obviously the resources are limited, as we know.
I think hearing all this, one takeaway message to simplify, I guess, for all parents is consequences. So I think we are now living in an age where we no longer, we try to save our child because we love our child. They never get to experience failure or a consequence of something that they do because we pull them out. And I think the schools also are catering a lot to being overprotective. How can we do to help you? So when students go off to college, it's too much of a change to becoming independent from being helped with all the different people. So maybe the simple thing that as parents, as individuals, we can do is a child enjoys a computer game. So if a child enjoys a computer game, it's got levels and it has rules. If you finish level 1, only then can you access level 2. And parents feel scared sometimes that if I set the rule or if there's a boundary, the child is going to hate me. And actually the child responds better. Sometimes the bad behavior is a way to get the parents to say, this is the limit. And sometimes if the parents do that with love, children respond. So that, I guess, in the family therapy works out well if they can see that love from both sides, but being expressed in an angry fashion. Mm-hmm. Just a comment.
No questions.
On a encore 5 minutes.
We still have 5 minutes left. I still have a question. Erickson approaches, lifespan, etc. What is the whole purpose of teenage life? What do you acquire during this period of life? I'm not even sure that's a biological period of life. I think it's a social period of life that actually is related to many social specificities. So what are the expectations? What is the whole purpose, the objective of this period of life in our 21st century Western civilization here?
This is a discussion that I had with Christophe the other day. So, if there are no questions, let's speak a bit more generally about teenagehood, and adolescence, which, we all know, particularly for clinicians, it's in between being a child and being an adult, right? So they're both at the same time and none of that, right? So obviously there's a lot of change. There's puberty, which is a disaster, and everything changes. So they're constantly adapting to change. It's a sort of a state of everything changing the next day. Imagine ourselves in a job where everything's changing. You're constantly on high alert, and one becomes more emotional, impulsive, and so forth. But as Christophe is saying, sometimes it's quite helpful to understand. I'm a parent as well of a young teenager, and I do all the same mistakes, But of course, is to understand how beneficial teenagehood and teenage behavior is, right? And Christophe was referring to Charles Dickens, who actually spoke about that. In most civilizations, teenagers represent a particular role, even within different species and certain species of animals. Teenagers represent a certain role. And I think it's quite helpful to think about that, because teenagers, certainly in Western modern society, they're always changing the habits, changing the limits, pushing the boundaries. We all text on our phone now as a main form of communication. That the teenagers were doing for 10 years before we took it on, And those are type of examples. And I think it's sometimes helpful just to remind ourselves, even if they are such hard work, that they are constantly pushing things, questioning things, going against things for the better good, really, of society. And yes, there needs to be consequence, absolutely. Consequence is best applied when we're not angry, because when we're angry, our consequence is rarely fair. Like getting stopped in the street by a policeman who's screaming at us. We rarely take responsibility for our speeding, do we? We just kind of say, what is this country or this policeman? Yeah, you know, if we want our young person to take responsibility for his behavior and understand the consequence, we're best delivering it without any anger or crossness. And also the other point, you know, consequence needs to be unpleasant. Yeah, I mean, you know, it's the basis of prison, isn't it? You know, if you go to prison and it's a great time, you know, it's not very. I keep comparing to prison, I'm sorry, yeah, but it's just very helpful to think of it that way. You know, consequence needs to be unpleasant. It doesn't have to be punishing and mean and upsetting, but it has to be unpleasant. Otherwise, what's the point, right? But so coming back to the initial point on teenagers, so definitely, you know, they are there to push boundaries. That's what they're made of, and that's what they do. And furthermore, their emotional development. So they're between a child and an adult, but on an emotional basis, what really happens is when you're a child, you're very happy to be told what to do, more or less. Very happy to just get it right and get praise. You know, most kids in that framework are very happy and thriving. When you're a teenager, that does not work anymore at all, right? When you're a teenager, what matters is that you are your own person. You are independent. And the best way to be sure that parents who you have gotten along so well with for years are not actually making your decisions for you is just to go against everything they say, right? Then you're sure that whatever you do is not their decision, is not their influence. So obviously it's a way of presenting it, but it's quite true because teenagehood often starts that way, you know, that you know, kids saying no before they've even heard what you have to say, and what you're going to tell them is actually what they've always wanted. And then when you tell them, they kind of disappointed to have to agree with you. You know, it's kind of reluctantly, well, okay, etc. So that's a bit what happens emotionally, and therefore you're best accommodating a bit of conflict. So it's much better for the conflict to take place around bedtime, around what they're looking at on TV. The fact that they're looking at rated 15 movies when they're 12, it's much better to have conflict around that than on drug taking and failing at school and so forth, because, you know, a lot of kids will be failing at school, or not all, I mean, there's many reasons to fail at school, but will be deliberately not giving any importance to doing well at school because they perceive so clearly how important it is for their parents that they do well at school. I mean, that's just very typical, and that's where you don't want the conflict to settle, right? You want it to settle in other areas. So as you say, being in conflict, acting out, being generally a nightmare, yeah, is what teenagers have in them. It doesn't last forever. So that's the ultimate advice to parents who are really struggling. Is it's just going to last a couple of years. Just keep in there, and yes, there are benefits to it for themselves, for society, and that's just how it is.
Merci, Paul.
Thank you, Paul. Thank you very much. We're now having a break. And we come back here at 4:45 with Perspective Jeunesse. Thank you.